Good afternoon, everyone, and thank you so much for joining our group. So, we are always happy to help you, we are always happy to support you. However, not passing the exam from the first attempt or the second attempt can be quite hard, can be quite annoying, can be also heartbreaking. However, what I would like you to know is that this is not the end of the world. There's always lots of hope out there. It's very important to start preparing as soon as possible. And that's because if you leave it for so long, this means that you might lose a bit of the structures that you've already got, anyways. So it's very important to take your time, try to relax, chill out, unwind after getting the exam results. However, don't let anything really beat you. Don't let anything let you down. At the end of the day, this is an exam, meaning that many people tend to not pass and some people tend to pass at the same time. It's very important to have a very smart plan. Very important to have a plan that really suits your needs. So that's a very important thing. Very important also to understand what the weakness points are and to act on them as quick as possible. Sometimes you cannot really see where the weakness points are. Nobody actually tends to tell you if you do practice with your colleagues, if you do practice with your peers, because they are in the same situation. Sometimes they don't see what weakness points they have got, and sometimes it's also difficult to reflect on any weakness points that you yourself have got. So it's very important to get a very good hint about how your performance is. And this will not come until you get that from an expert. That's a very important thing. Now, starting preparation after not passing the exam can be quite hard, as we have mentioned, but time flies by, time goes very quickly. So if you don't pay attention to time, you might end up by being in a hurry before your exam, trying to wrap up, trying to cram through things that you haven't been through because you were feeling unwell because you didn't pass the exam. So it's very important to start as quick as possible. However, as we've mentioned before, please start smart, not just hard. Many doctors do hundreds and hundreds of cases practicing with our colleagues, still they don't pass. Why is that? If they keep repeating mistakes again and again, and nobody actually tells them about that, unfortunately, the outcome is going to be the same. So think about it. How can you invest in yourself? It is very important. Invest in yourself the right way. Invest in yourself by doing a very well prepared practice. So that's the main thing. This actually will avoid you having to go through another attempt, pay extra £1,200, pay extra time as well, stress as well, which costs a lot and a lot of your time, which is also, it's a very important thing that you don't want to go through again and again and again. So my sincere advice is that start practicing smart way. Have a good resource in hand. This is a very, very important thing. Good resource meaning that a resource that not only giving you information, but also a resource that provides you with a way how to deal, how to think like a GP, how to deal with a patient, how to tailor the plan according to the patient needs. We offer that, of course, in UKPASS via doing the extensive course, and also we offer the management plan, which is a management summaries course, which is a final revision course, which is very important to cram through before your exam. If you do not attend our courses, this is absolutely fine. You can still take your time. You can still take a longer period of time to prepare, which is absolutely fine. It all depends on where you are at the minute. However, it might take you a little bit longer to ace the exam. So it's very important. Start practicing from today. Read the notes that you've got In addition to reading the notes, you need to prepare, you need to practice with your colleagues, as I mentioned, the right way. So do that simultaneously. Read notes and at the same time practice. So don't stop practicing because it is very important to keep things going. In one of our videos before, I mentioned about it's very important to keep the pace going quickly. Remember, SCA exam consists of 12 cases, 12 minutes each, meaning that if you see patients in your day-to-day life within 20 minutes, this is not going to get you into exam space. Actually, if you see patients in 15 minutes, that's still more than required, but it is reasonable. So start doing that. Start applying structures that we discuss with yourselves. You don't have to apply the full structure with every single patient you see because it's very difficult to do that in 15 minutes. So start by doing a specific application of specific structure. For example, you're going to practice data gathering in this patient. You're going to practice interpersonal skills with the other patient. I'm going to apply ICE in this patient. I'm going to discuss management plans and make it shared. And this is how you're going to get to the exams mode. This is very important. Start by doing that as soon as possible. Don't hesitate to get back in touch, please. If you need any help or support, we are always in UKPASS. Very glad, very passionate about helping you. Please reach for help if you need any at any point of time, or if you would like some help from my side. My name is Dr. Khalid. I'm the founder of UKPASS Medical Academy. Please get back in touch with me and I'll do my best. I'll work hard with you to get you to pass this exam with flying colors. Thank you so much, everyone. I hope you have a good afternoon as well.